The kidney meridian runs from the bottom of the foot right up to the top of the chest. Let's look at the pathway of the kidney meridian, and then we'll take a look at those individual points. So the kidney meridian begins on the bottom of the foot, and it travels up the side of the inside of the foot, up along the medial aspect of the leg to the knee, and then picks up again at the top of the pubic bone, just a half a sun lateral to the midline, and it travels up a half a sun lateral to the midline till it gets up to the xiphoid process, and then it branches out to be 2 sun out from the midline, and it travels up to the top of the chest. So we saw a similar pattern with the stomach meridian and with the spleen meridian. The kidney meridian, the spleen meridian, and the stomach meridian all travel across the abdomen close to the midline, and then at about when we get up into the rib cage, they spread out and move further, they move wider. So the kidney meridian is a half a sun lateral to the midline till it reaches the chest, and then it becomes 2 sun lateral to the midline. The stomach meridian is 2 sun lateral to the midline on the abdomen. When it gets to the chest, it becomes 4 sun lateral to the midline. And the spleen meridian we saw at 4 sun lateral to the midline, and when it comes up to the chest, it moves out to about 6 sun lateral to the midline. So there's this traveling up, moving out pattern that we see to these meridians on the abdomen. Now let's take a look at the points on the leg, on the kidney. So let's take a look at these points a little bit more closely. Let's move your foot. Thank you. Kidney 1 is located in the center of the, or the heart of the sole of the foot. And so where we can see where these 2 pads of the foot, of the front of the foot come together, right in here is kidney 1. And again, it's if you were going to pick a spot on the bottom of the foot, would say kind of the heart of the sole, this would be at your foot. Your finger really kind of anchors right in that one spot. Remember, this point is on the bottom of the foot. Again, this is thick skin, and similar to points like pericardium 8 and heart 8, anything that's in the palm or on the sole of the foot. When we're needling, we generally want to place our acupuncture needle, place that tube firmly against the skin and give it quite a bit of pressure, a good amount of pressure there, so we tap the needle in quickly and we can set the needle and it won't be painful for the patient. So here's spleen 1. Spleen 2 is located under the navicular bone. And so if we palpate these bones up in here, the bones that are most prominent and easily palpated are the head of the first metatarsal, and then just proximal to the head of the first metatarsal is the navicular bone. Just inferior to the navicular bone is kidney 2. So kidney 1 is located here. Kidney 2, I'm going to get a little bit more of a bend to the foot. Kidney 1 is here. Kidney 2 is here. And kidney 3 is located between the Achilles tendon and the medial malleolus, level with the prominence of the medial malleolus. So kidney 3 is right here. And if we take a look at this line from kidney 1 to kidney 3 to kidney 1, if we draw this line in here, we end up coming just under the navicular bone where kidney 2 is located. So it's kidney 1, kidney 2, kidney 3. These are some of the main points. Kidney 2 is very good for any kind of heat or deficient heat in the lower warmer. Kidney 3 is the yuan source point of the kidney. Kidney 1, many practitioners use it to ground patients or, again, for pain anywhere in the body. So these are main points. Kidney 7 is also quite a common point, and so is kidney 6. So kidney, let's count them off again. Kidney 1, kidney 2, kidney 3. Kidney 4, 5, and 6 kind of make a bit of a circle around the ankle. So if you look at a picture of the kidney meridian, you'll see the kidney line comes up like this, and it goes to kidney 3. It makes this circle, and it comes up and goes to kidney 7. So the points are kidney 3, kidney 4 is just below kidney 3, kidney 5 is just below kidney 4, and kidney 6 is anterior to kidney 5. So kidney 6 is just below the medial malleolus. The books will tell you that it's 1 sun below the medial malleolus, and on our model here, I would put kidney 6 1 sun below the medial malleolus. Sometimes we find the space a little bit closer to the bottom of the medial malleolus, but anywhere about 1 sun south of the medial malleolus will give you kidney 6. Kidney 6 is also an important point. We use it for activating the 8 extraordinary meridians. So kidney 3, kidney 6, very important points. Kidney 2, also commonly used. Kidney 7 is located 2 sun superior to kidney 3. So kidney 7 is here. Kidney 8 is just in front of kidney 7. And kidney 9 is 3 sun higher than kidney 7, or 5 sun from kidney 3. So it's kidney 3, 6, 7, 9. Right? These are the big ones. And kidney 10 is at in between the 2 tendons of the semitendinosus and semimembranosus here in the knee. Let me just needle a few of these points for you. Kidney, we'll needle kidney 2 under the navicular bone. Kidney 3 between the medial malleolus and the Achilles tendon. And kidney 7, which is 2 sun superior to kidney 3. These are points that are very commonly used on the kidney meridian. Now let's move up and take a look at the kidney meridian. Remember, from kidney 10, the next point, kidney 11, is on the abdomen. So let's move up there and we'll needle a few of those points as well. So the kidney meridian then picks up on the abdomen, and it picks up at this level. We're getting kind of used to this level at the top of the pubic bone, which is where Ren 2 is in the center of the top of the pubic bone. Kidney 11 is just a half a sun off. Kidney 11, 12, 13, 14, and 15. The kidney meridian runs up 1/2 sun, right? So one, just a smidge off of the midline, really. Just like that. So we find the kidney meridian traveling right up this way. You may notice in the video here that our model has a little bit of a bruise here, and it may as well take a minute just to point this out. This came from needling Ren 6 the other day. We did hit a small blood vessel under the skin when we took the needle out. There was a little drop of blood. We put a cotton ball in there and rubbed it down. There was a little bit, we could feel a little bit of a bump there, and that was 2 days ago, and there's a little bit of a bruise that still remains there. So that's quite common side effect of acupuncture. Kidney 11, 12, 13, 14, and 15, and kidney 16 is right here level with the belly button. I want to point that out for a minute. Kidney 16 is a particularly useful point for strengthening the kidneys. Right? Kidney 17, 18, 19, and 20, we continue all the way up here, and then the kidney meridian also branches out to be 2 sun out from the midline, and it ends up just under the clavicle at kidney 27. So for needling these points on the abdomen, I'll needle kidney 16 for you, which is going to be right on the borders of the belly button. Kidney 16, kidney 16, and I'm going to needle both sides here just to kind of give you a sense. Oftentimes, when we're needling points, we needle bilaterally, and this is a good opportunity to demonstrate that. When we come up into the chest, I just demonstrate kidney 26 or kidney 27 here. Again, the mid-clavicular line is 4 sun. Half that distance gets us 2 sun from the mid-clavicular line, from the midline, and again, these needles are always placed on a transverse or transverse oblique angle, and these would be needled like that. Okay. We'll move on to our next meridian.